Hi, Jimmy.
Yeah.
Jimmy, my name is Jeremy. I'm the CRNA that's going to be with you during surgery today.
Good.
So tell me a little bit about why you're here, why you're having surgery today.
About 6 weeks or so ago, I fell off a ladder at work and hurt my knee over here.
Okay, so it sounds like you had a work injury about 6 weeks ago.
Mm-hmm.
Yeah, so they did an MRI last week and looks like you had a tear there, so definitely surgery is appropriate.
Sure.
Are you having pain right now?
No, pretty comfortable.
Okay, so no pain right now.
No.
Are you breathing okay?
Yeah, breathing's fine.
Okay, any concerns about the surgery before we head in there?
No, I don't think so.
Well, before we go ahead, Jimmy, what I'm going to do is I'm just going to do we call it like a head-to-toe exam. I'm just going to listen to your lungs, your heart, check you out, just make sure that you are ready to go for surgery.
Great.
Do you have any questions?
I don't think so, no.
Okay, I'm going to start out by getting some numbers, some vital signs.
Sure.
I'm going to check your blood pressure,
Sure.
take your temperature, things like that.
Mm-hmm.
Okay, so Jimmy, your blood pressure is a little high. It's 180 over 85.
Oh, okay.
Do you know if you normally have high blood pressure?
I'm not too sure.
Okay, I'm going to go ahead and listen to your heart. I'm going to take your temperature, check your pulse. Okay, so everything looks good. You got a little bit of a low-grade temp. Breathing a little bit fast. Are you short of breath right now?
No, I'm
Okay.
breathing okay for now.
And your heart tones, everything sounds good. So maybe after surgery we'll follow up and see what's up with that elevated blood pressure.
Sure.
So what I'm going to do is I'm going to go ahead and just do a head exam. I'm going to kind of touch your head and stuff like that, check your eyes.
Mm-hmm.
So I'm going to palpate any problems with your scalp or your hair?
I don't think so, no.
Okay, I'm going to go ahead and palpate all your lymph nodes starting in front of your ear, behind your ear, the pre-auricular, submandibular, submental, anterior cervical, and the posterior cervical, and occipital lymph nodes.
Okay.
So none of those feel enlarged, they feel good. So
Yeah.
I'm going to check the range of motion in your neck. So why don't you go ahead and bend your neck forward against my hand, and then backwards. Perfect. And then to the left, and then to the right. Good. Can you rotate your neck left and right, and then up and down? Any pain when you do that?
Nope.
Okay, good. Next thing I'm going to do, Jimmy, is let's see here. We're going to I'm going to have you shrug your shoulders up and down. Good. I'm going to look at your neck. I'm going to palpate here. Trachea looks normal, midline, and it shifts easily from left to right.
Good.
You're able to shrug your shoulders. That's good. So I'm going to go ahead and check your eyes.
Okay.
So first thing we're going to do is, I noticed looking at your eyes, they look normal. No swelling or redness around the conjunctiva or anything like that. I'm going to check your eye movement. So what I'm going to have you do is look at my finger and just follow my finger with your eyes and not your neck, okay? Perfect. And then keep looking at my finger. Good. Any problems doing that?
No.
Any problems with your vision?
No.
Okay. So what I'm going to do now is turn the lights down, and I'm going to shine this light in your eye.
Okay.
Perfect. So your pupils are equal around, and they react to light. Extraocular movements look intact. And I'll check your visual fields on each side. So when you see my fingers, so I want you to look straight ahead. When you see my fingers wiggle, let me know, okay?
Okay. I see it.
Perfect. So when you see my fingers wiggle, let me know.
Okay, I see them.
Perfect. One last thing I'm going to do is check your eyes with the otoscope.
Okay.
And with my left eye, I'm going to look into your left eye and check your retina. Looks perfect. Same thing with my right eye. I'm going to look into your right eye. Perfect. There, it's recording.
Okay, Jimmy, I'm just gonna take a look at your ears here bilaterally. Looks like you got normal pinna shape. No skin tags that I can see. I don't see any pre-auricular pits at all bilaterally. So that's good. I'm gonna palpate the tragus and pinna. Okay, feel just fine. Now I'm going to perform an otoscopic exam, okay? So I'm going to take a look here. Okay, come over to your right side. Good. Okay, well, I don't notice any lesions or arrhythmia in your ear canal. That all looks good. What I'm going to do next is called a whisper test. I'm going to stand behind you. I'm going to cover one of your ear and say something, and then I'll ask you if you can repeat that for me, okay?
Okay. 3, 5, 7.
Good. Okay. Next, I'm going to do a Weber test, which will actually help us assess your 8th cranial nerve. I'm going to take a tuning fork here, and I'm going to tap it here and get it vibrating, and I'm going to ask you if you can hear it better on one of your sides here.
Okay.
Okay? Okay.
Sounds equal on both sides.
Okay, good. All right. Now I'm going to do what's called a ringing test, which helps us also assess your 8th cranial nerve. Using this tuning fork here, I'm going to assess the air conduction versus bone conduction. Okay.
Okay.
So I'm going to kind of come back here and touch it to your mastoid process over here. Okay. And that seems to be normal. It seems that the air conduction is greater than the bone conduction. Next, I'm going to take a look at your nose here. Doesn't look like there's any presence of discharge or lesions. That's always nice to see. Have you noticed any differences or issues with breathing or blowing out
No,
as far as with your nostrils on both sides bilaterally?
Yeah.
Okay, it appears that there's equal patency in his bilateral nostrils. I'm going to inspect his septum, turbinates, and nasal mucosa with the otoscope. Okay. Yeah, those all look good. No presence of septal deviation, appropriate turbinate size and color. The color mucosa looks appropriate. I didn't notice any lesions or discharge. That's all great to see.
Good.
I'm going to palpate your frontal and maxillary sinuses here. Okay, that feels fine. Any pain when I do that?
No pain.
Good. Okay, next I'm going to inspect your mouth and throat. First I'm going to take a look at your lips here. Good color, good pink, no lesions noted. I'm also going to take a look at your oral mucosa. So can you open up your mouth here? All right, looks good. No lesions noted, nice and pink. I'm going to inspect the posterior pharynx, your tonsils and palate, and your uvula. So if you can open up your mouth nice and big for me. Good. All right, there's a good pink color. The uvula is in good position, nice and midline, no discharge, exudates, or lesions noted.
Great.
So any issues with your mouth, nose?
No, not that I can think of.
Okay. Throat feels okay, no pain or any issues swallowing?
No pain.
Okay.
No problem swallowing, no.
All right, so I'm going to help assess your cranial nerve 9 and 10 here. All right. So I'm going to have you open up wide and say ah. All right. Looks good. The uvula is nice and midline. I noted some soft palate and uvula movement when you said ah, so that was good. Can you stick out your tongue for me? Okay, good texture, no lesions noted. It appears to be midline, your tongue that is. Next I'm going to inspect your thorax. Inspecting your chest here. It looks good. Your anterior to posterior diameter looks symmetrical. Can you take some deep breaths for me? Okay. Any issues with your breathing or chest pain?
I get short of breath once in a while, but
Okay.
not right now.
Okay. Do you smoke?
I do.
Okay.
I've been smoking every day for the past 15 years, and I don't want to quit.
You don't want to quit. So, would you be? You say you don't want to quit, so you probably wouldn't be interested in any smoking cessation education or any resources that might be available.
Well,
or?
you can give it to me, but I don't think I'm gonna quit.
Okay, sounds good. All right. So I don't notice any deformities or retraction. like I said, the anterior posterior to transverse diameter looks appropriate. I'm going to palpate your supraclavicular and infraclavicular lymph nodes here bilaterally. Okay. Any pain?
No pain.
Okay. I'm going to perform some tactile fremitus here in your back. So I'm going to be palpating back here. And can you say 99 for me a few times?
99, 99, 99, 99.
Okay. Thank you. All right. And now I'm going to auscultate your lung fields anteriorly and posteriorly, okay?
Great.
So will you take some deep breaths for me?
Sure.
Okay. All right, some more deep breaths for me, please. Good. Your lungs sound nice and clear.
Great.
Now I'm going to listen to your heart, okay? I'm going to kind of shift gears to some more of a cardiovascular assessment.
Okay.
To start here, I'm going to listen in the aortic area, in the second intercostal space, on the right sternal border, okay? Now I'm going to listen on the pulmonic area in the second intercostal space in the left sternal border, excuse me. Okay. Now I'm going to listen in the precordium in the tricuspid area, which is located in the fourth intercostal space in the left sternal border.
Awesome.
In case you're wondering. Now I'm going to listen to the precordium in the mitral area, which is located in the fifth intercostal space of the midclavicular line. Okay. I'm going to kind of shift gears here, still assessing your cardiovascular system, but move down to your ankles. So I'm going to assess your bilateral ankle range of motion,
Okay.
primarily inversion. So can I have both your ankles move around for me, please? Okay. And I'm going to assess your bilateral ankle strength, dorsiflexion and plantar flexion. So I'm going to have you push down with both ankles. Good. And pull back. Good, equal strength there. Any issues, any pain with that movement?
My knee hurts a little bit when I do that, but
Okay.
obviously.
Sure. All right, so now I'm just going to ask you some quick questions. It might be kind of silly, but we ask everybody. Can you tell me what time it is?
It's about 3 o'clock, 3:30.
Great. And where are you?
I'm at Tria.
Okay, great. I'm going to, for now, say 3 different words.
Okay.
And I'm going to ask you to repeat them right back to me, right after I get done saying them.
Okay.
Dog, carrot, baseball.
Dog, carrot, baseball.
Perfect. And can you spell the word world for me backwards?
D-L-O-R, no.
It's tricky.
D-L-O-R, oh my God. D-L-R-O-W.
Perfect. That's tough. You remember those 3 things I mentioned about 30,
Yeah.
45 seconds ago?
Dog, carrot, baseball.
Yep. Perfect. Yep. Yeah, good memory. Can you repeat this little saying for me? No ifs, ands, or buts.
No ifs, ands, or buts.
Perfect. Well, Jamie, I wrote out a little instruction here.
Okay.
And all I ask is that you do what it says.
Okay.
Okay?
So it says, do arm circles for 5 seconds. Good.
Yeah, that's perfect. Thank you. Yep, I wrote do arm circles for 5 seconds. That's perfect. Okay. Pause, right?
Just hit the green.
Or it's...
Okay, Jimmy, so just to finish up the exam, I'm just going to do some tests to test your sensation and some reflexes and some of your brain functions. Okay? So what I'm going to have you do for this part of the exam is I'm going to have you keep your eyes closed and I'm going to take this cotton ball, actually it's an end of a Q-tip, and I'm going to touch it around various parts of your body, and then when you feel me touching, just say the word now, and that'll let me know that your sensation is intact. So go ahead and close your eyes.
Now, 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 now.
Okay, can you give me your left hand? Good.
Now, 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 now.
Good. And your right hand?
Now, 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 now.
Perfect. Keep your eyes closed.
Now, 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 now.
Perfect. Keep your eyes closed.
Now, 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 now.
Perfect. That's really good. Okay, so Jimmy, you can open your eyes for a quick second. So basically I'm going to do the same thing, but this time I'm going to do it with a little sharp object, and what I'm doing is assessing your pain sensation.
Okay.
This isn't going to hurt, so just close your eyes, and again, when you feel me touching you, just say now.
Okay. Now, 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 now.
Good.
Now. Now.
Okay.
Now. 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 Now.
Good.
Now. 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 Now.
Good. Okay, you can open your eyes. Okay, so the next thing I'm going to do is with this tuning fork again, I'm going to test your ability to feel vibrations. So what I'm going to have you do is put your arms out, just like that. I'm going to have you close your eyes, and let me know if you can feel this vibration when I place it on your finger.
Yep.
Good.
Yep.
Okay. I'm going to do the same thing on your toes.
Yep. Yep.
Okay, good. Okay, good. Relax there. One other thing I'm going to do is, continuing along, checking your sensation, I'm just going to assess how well you can, or just put your hands out, and then Jimmy, this is up. Right, you can put your right arm down. I'm just going to do the left side. So this would be up, and then this would be down.
Okay.
Okay, so what position is this?
Up.
And then what position is this?
Down.
Good. Okay, keeping your eyes closed, Jimmy. In your left hand, I'm going to place an object, and I'm going to have you tell me what it is.
Okay. This feels like a hammer upside down.
I'm going to take that out. Keep your eyes closed. And in your right hand, I'm going to place an object.
Okay.
And you tell me what that is.
This is a marker.
Perfect. You can open up your eyes. And one other thing I'm going to do to test your sensation and your brain function is I'm going to draw a number with my finger in the palm of your left hand. I'm going to have you close your eyes and have you tell me what number that I wrote.
Okay.
So go ahead and close your eyes.
3.
Perfect. I'll do that on this side.
6.
Perfect. Okay, so you can open your eyes, Jimmy. So what I'm going to do is on each side of your body, or each arm, I'm going to test your bicep reflex, your tricep reflex, and your brachioradial reflex. And I can do those all at once, so just relax your hand. So with this reflex hammer, so that's good, good, good. Do the same thing over here. Maybe put your arm right there. Good. Your reflexes all are intact. And now I'm going to check your patellar reflex, your Achilles reflex, and then I'm going to slip off your shoes and do your Babinski reflex.
Okay.
Perfect. So just go ahead and stay relaxed. That's good. That's good. 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 And what I'm going to do is using this fork, the soft part, I'm just going to scrape the bottom of your foot. Perfect. So your toes are down going, so that's normal. It means you have brainstem integrity left. So for the next parts of these tests, Jimmy, I'm going to have you stand up right here and just face me. So with your feet together, and then can you close your eyes?
Mm-hmm.
And can you stand on your left foot? Good. And I know you're having pain, but do you think you could do this on your right?
Yeah, I'll try
Okay.
here.
Okay, that's good, Jimmy. Why don't you go ahead and sit down, take a little break. I'm going to have you put your arms out in front of you with your palms up, kind of like you're holding a pizza. Put them up a little bit higher, and go ahead and close your eyes and keep your hands there. So keep your hands there if you can. Perfect. You can relax your arms and open your eyes. Jimmy, I want you to do this with your hands. Perfect. And can you do the same exact thing? Can you put your feet on the ground maybe?
Mm-hmm.
And kind of do the same thing. Yeah, that's good. You can go ahead and have a seat. What I'm going to have you do now is close your eyes and put your left hand out in front of you and touch using your index finger on your left hand, go ahead and touch your nose with your eyes closed. And do that a few times. Good. Let's have you do the same thing with your right hand, right index finger to your nose. Perfect. Okay, you can open your eyes. A couple other things. I'm going to have you take your left heel and trace it across your right shin. Just go up and down. Perfect. Let me have you do the same thing with your right. Good. And I know your knee kind of hurts, so sorry about that.
Oh, that's okay.
A couple other things, Jimmy, then we'll be done. I'm going to have you stand up again, and I'm just going to have you walk over here and then walk back. Okay, I'm going to have you do the same thing, but can you do it on your tippy toes? Okay, and you can turn around and go back. And I'll have you do the same thing on your heels. And what I'm assessing is that you have a normal cadence and a rhythm, and that you have good balance and no abnormalities or asymmetric movements. So good. Exam is over. We can go ahead and proceed with surgery.
Great.
Awesome.